So we've covered a lot of information up to this point. So where do we go from here? This next series of exercises are concepts that where the exercises all feed in together. And we've talked about them a little bit. And that is the idea of the physical ability to be able to push our hips forward with most of the work coming from the glute max, the main rear end muscle. And then also to have the motion or the length in our muscles to be able to push the hips forward. So the muscles in the front of the legs or the hip flexor muscles to be able to relax enough to allow the hips to be pushed forward. And a simple exercise you can think about this is the bridge. So lying on your back and being able to lift the hips up. A lot of things go together to make this be able to happen. This is a very, very important exercise or basically daily life function. In order to be able to move in bed, to be able to do anything that we do, we need to be able to lift our hips up with our feet flat, knees bent, and to be able to ideally use the proper muscles. So what we want in that case is for the glute max to engage and to be able to lift the hips up. And of course, there's going to be some activation from the lower back a little bit, but we don't want over dominance from the lower back. And there might be a little bit of help from the hamstring muscle, the muscle in the back of the leg, but we don't want over dominance from the hamstring muscle. We want this exercise to be majority the glute max pushing the hips up. But what else is going on here? As we're pushing our hips up and forward, the muscles in the front, that hip flexor complex that we keep talking about, needs to be able to be long enough in order to allow the hips to go up. And even more so, what happens is if those hip flexor muscles are tight, they basically shut down the glute muscle in the back. And then if the glute muscle in the back is weak, that promotes the hip flexor tightness in the front. So the two kind of like feed into each other again. So there's this perpetual cycle of a feeding into a negative cycle of tightness in the front and then weakness in the back. And then that leads to decline with walking, decline with the ability to be able to stand up from a chair, and the ability to be able to simply lift our hips up when we're lying in bed, and results in a lot of problems. So what to do about this? A very simple way to start is if we're lying on our stomach, to be able to basically lift our leg up against gravity. And so we're just lying on our stomach. Can we basically use our rear end muscle to lift the leg up just one at a time? Lift up one leg and then lift up the other leg. Can we lift it up about 10 or 20 degrees or so? Can we lift up the leg about 10 to 15 degrees or so? And then that's it. Can we use the rear end muscle, the glute max muscle, to lift up the leg? Or do we have to compensate somehow in order to do so? Do we have to swing the hip side to side? Do we have to use the hamstring? Do we have to use the lower back primarily to lift the leg up? Now, of course, the other benefit of this exercise is if done correctly, it does strengthen the lower back correctly as well. And then even some of the deeper muscles in the lower back closer to the spine, the multifidi muscles, are strengthened when we do this sort of an exercise. But our main focus is in the glute max muscle to be able to lift the leg up when we're lying on our stomach. Now, of course, there's additional value in can the person lie on their stomach in general. And so if it's an older person and you're not quite sure, of course, we want to make sure that they can lie on their stomach safely, that they can turn their head or move their head in such a way that they're able to breathe so that their head is not just straight into the pillow. Simple things, but these are things that could be a problem if an older person goes onto their stomach, but then they're not able to move their head in order to open up their airway so that they can breathe. So you want to make sure that these basic things are there. And if you have problems with these sorts of things, that might actually be a sign that actually get a rehab professional to be able to help you with these things. Because if you have someone who can't lie on their stomach, that's a very basic function that they should be able to do for a lot of reasons. And so what we want to do is then, contact a rehab professional, get home health, go to outpatient, whatever you need to do. Because if you can't lie on your stomach, then there's a problem. And so a rehab professional can help. If you're getting radiating pain down your leg when you're lying on your stomach, then don't do that. And then you need to see physical therapists and figure out, why am I getting radiating pain when I'm lying down on my stomach? So not a good thing to happen if you start experiencing that. That is the other value of doing these exercises, by the way. It's not just the benefit of the value and the progression. It's also, okay, what problems come up when I do these exercises? And the problems might actually bring out problems that are there that you're currently not thinking about or addressing. So then the solution then is get to a rehab professional, get to a physical therapist so that you can figure out how to do these things. And why is this problem there? Why am I getting radiating, shooting pain down my leg when I lie on my stomach? I didn't know that was a problem. Well, that's a problem. And so that needs to be addressed by a skilled professional, at least a doctor, but preferably a physical therapist to help figure out what's going on. And so then if you do need a doctor or another type of medical professional, you can go that route, but go to a physical therapist, figure out, why am I getting shooting pain down my leg when I am lying on my stomach? So let's say all is well and good. We're able to lie on our stomach okay. We're able to lift the leg up against gravity. and we're able to utilize our glute muscle. Very good. And so being able to progress that and alternating again, increasing the reps until we're able to do more. And that's going to also help us to be able to stand up from the chair, because it's going to be that glute max muscle that's going to push our hips forward as we lift ourselves up. So the quadricep muscle, the front of the thigh muscle, straightens out the knee. The glute max muscle pushes the hips forward, and then we're able to lift ourselves up when we go from sitting down in the chair to standing. And then being able to do this basic exercise of lifting up the leg, utilizing the glute max muscle is huge to be able to have the appropriate amount of strength that we need. And again, increasing it from there. A lot of people really struggle with this. And the reason is because the glute max muscle for a lot of people starts declining very early in life. In our 30s, 40s, or even before them, a lot of people have weakness in their glutes that should not be there. And it's from sitting, it's from just over dominance of other muscles, over dominance of the hamstring, over dominance of the hip flexors, all sorts of problems that can result in the glutes getting weak. And so this can cause problems with walking, with posture, with standing, can cause back problems. If the glutes are weak, it can result in a whole host of problems that need to be addressed. So if we're not able to lift the leg up against gravity, very simple step down from there is just basically with one knee bent and one leg straight, have the person push the heel down into the bed or the therapy table or wherever they're at. And then that way they can activate the glute max muscle, pushing the heel into the bed when they're lying on their back. So that way you don't even have to worry about them lying on their stomach. They're lying on their back, one knee bent, the other leg straight, and pushing the heel into the surface that they're lying on while they're lying on their back. And the key here is you have them focus on pushing the heel down with the glute max, not the hamstring, not bending the knee, but keeping the knee straight and pushing down with the glute max. Now, let's say if they're not able to do that, they can't connect in that way, then even more basic than that is having the knees bent, feet flat, and then just basically squeezing the glute muscle. Try to get them to squeeze the glute muscle and try to get some activation that way. This type of thing you'll commonly find if you're going into the hospital and there's a lot of weakness going on. That might be something that you experience that the physical therapist will have you do, just basically doing glute squeezes. We need to activate these muscles in some way. Again, there's that mind-body connection. Very, very common problem with the glute max. Again, this happens early in life. I had to work on this for about 9 months of trying to get my glutes to activate more and my hamstrings less. So I've gone through this process as well. My hamstring muscles wanted to do everything when I was younger. So when I was about 22 years old, I retrained my body to basically activate from my glutes instead of my hamstrings. And if I have a period of time, let's say when I'm not strength training as much, during the pandemic, not a lot of people were going to the gym. And so I wasn't exercising the way I normally did. And then trying to get back to the gym when all that was kind of getting over with, there was that hamstring dominance again. The hamstrings were pushing my hips forward rather than my glutes. So I had to do a little bit of retraining. It didn't take nearly as long. I had to retrain my glutes again to activate when I'm doing squats, lunges, whatever it might be, so that I wasn't getting dominance from another muscle. And this is why the glutes tend to get weak along with motion issues. Again, the hip flexor muscles tend to shut down the glutes. And so this is a very common problem that we need to address. We'll get to that in a little bit when we talk about exercises to lengthen out that hip flexor complex that we keep talking about. So with the strengthening the glutes, pushing the heel into the bed, if that doesn't work, then just activating the glutes, squeezing the rear end muscles, and start from there. And then from there, we're able to build on getting to the point where we're able to lie on our stomach and then lifting the leg up against gravity. You might think, okay, why can't I just stand and then lift my leg up and kick my leg back? You could try that. A lot of times what we find is a lot of our older clients have problems with that because there's a lot more to coordinate. But if you're able to do that, that can be another stepping stone towards being able to lift up against gravity as well. Just standing and then bringing the leg back, but making sure that you're utilizing the glute to push the leg back while you're standing up rather than using other compensations, movements, and other muscles. So being able to lift up the leg against gravity when we're lying on our stomach, very, very important to be able to progress to. Again, the value is in the progression. So we talked a little while ago about bridges. So being able to lie on our back and then be able to lift our hips up with our knees bent, feet flat, and lifting our hips up using the glute muscle to push the hips forward. And then to be able to get into full motion to be able to bring the hips up even with the knees and the shoulders if we're looking at a diagonal straight line. So that's the ideal bridge. And for the glute muscles to be the main mover to be able to do this, with a little bit of help from the lower back, that's fine. and then a little bit of help from the hamstrings, that's fine. And of course, you can go to single leg bridges and everything else, but let's refocus back a little bit. A lot of people struggle with just being able to do a simple bridge properly, including 20-year-olds. So when they do bridges, it's not uncommon then for the hamstring to cramp. So if your hamstring cramps when you do a bridge, you know that you have dominance in the hamstring. We call it synergistic dominance. Basically, the hamstring muscle is doing all the work instead of the glute. And this is where the mind-body connection comes into play on the bridge and all these other exercises that we're talking about. Now, it's important to understand that bridges are not always completely intuitive for people, especially if they're over the age of 80, 90 years old. It's not always the most intuitive thing. So incorporating a lot of these other exercises and getting increased motion in the front of the legs from the hip flexors, and then being able to isolate the glutes and get more activation from the glutes themselves, and then putting these things together with the bridge can be a way of progressing the bridge. And that's the way I would think of it. Think of the bridge more as about the movement and then the appropriate muscular activation to get into full hip extension, to be able to lift the hips up all the way forward as much as possible, or at least get progress with that in collaboration from these other exercises. Again, the other exercises are the activating the glutes themselves and then lengthening out the hip flexors in the front of the leg themselves. And then we're able to get to the bridge. Now, if we're not able to even lift the hips up at all, then just doing pelvic tilts can be helpful. But we're at that level, likely we need help from a rehab professional at that point. So don't hold back, get the help that you need, get to a physical therapist to be able to help you with some of these progressions. And of course, I'm sure they'll have progressions on their own. There's probably a lot of other things going on that need to be addressed if we're at that level. So having the leg go off the side of the bed or the side of the table, it's risky from the standpoint that the person, of course, can fall off the bed or fall off the table. So that's a problem. When, as rehab professionals, we tend to what we call body block the person when they're scooting to the edge. The other problem is a lot of them have a lot of tightness in the groin or the inner thigh muscle, so it can be hard for them to bring their leg out to the side, which of course promotes that they need to scoot to the edge even more, which promotes that they could be at risk of falling off. And so having the guidance from a rehab professional can be a very great fix for this. But this would be the progression: bring the leg out to the side and let the leg just hanging down. What's great about this is it's simple and they're able to do it. The person's lying on their back. Getting to stretching the hip flexors can be quite challenging as people get older, because a lot of the best ways and the most simple ways and the less stressful ways on our bodies to stretch the hip flexor complex come from kneeling on the ground. Even with a cushion, that can be a problem. We'll get to that later on. So stretching the front of the legs is actually quite difficult for people to do from a mechanical and logistical perspective. And that's another reason we tend to find a lot of quad tightness and hip flexor tightness, the tightness in the front of the leg that people experience, because as people get older, logistically and from a safety perspective, it's harder and harder and harder to do those sorts of things with people. So great progression. First, can they lie on their stomach? We already talked about lying on their stomach in order to lift their legs up against gravity to activate the glutes. So if they can lie on their stomach, that can actually be a great progression. So have them lie on their stomach. If they can go up to their elbows, even better. It can be great for their back. Again, if they're not getting radiating pain down their leg, it's a great thing to be able to do, to be able to lie on one stomach. And then if you can progress to going up on your elbows, even better. And then what that also does, it actually lengthens out the front of the leg. It lengthens out the hip flexor complex. And so that way we can get to working the glute max and the glute medius and glute minimus that we have been talking about this whole time. So we're able to lengthen out the hip flexor complex by lying on our stomach. And maybe if we can tolerate going onto our stomach, then we can go on stomach up on our elbows, and that brings our trunk back even more. And then that allows us to get even more of a stretch in the front of our legs. If we're able to have someone then bend our knee when we're in that position, that can also be helpful, because that's going to give us an even larger amount of stretch on the hip flexor complex. But again, you want to be gentle with this, because if you feel pain in the knee when you do this, you don't want that to happen either. And so you see some of the logistical challenges with stretching the front of the legs. So you can lie on your stomach, or you can lie on your back and bring the leg out to the side and then let the leg just drop down or on the side of the bed. You might notice that the leg actually doesn't drop down. It might be lifted up relative to the bed. That shows you how tight those hip flexors are. And so just allowing gravity just to kind of lower the leg down. If you do this over a period of time, again, you want to body block that person as you're doing it, so that way they don't fall off the bed. Again, getting a rehab professional can be very, very helpful in these sorts of situations. So allowing the leg to drop off to the side is a great way to start. Now, from here, and you may have seen this in outpatient physical therapy, having someone lie on their stomach, just on their stomach and then having a stretch strap connected to their foot, and then they're pulling their foot, bending the knee towards the bottom. Great stretch. The challenge can often be in the execution, is the logistical reality of it. So by doing that, we can get a great stretch of the hip flexor complex, but it can be logistically challenging to do, to put the strap on the foot and to be able to line our stomach and be able to do that stretch in without straining something else. Ideally, a great hip flexor stretch is kneeling with one knee on the ground, the other foot forward, and then our trunk is up nice and tall, and then we're able to bend the front leg, and then that way we're able to lengthen out hip flexor complex in a kneeling position with one foot in front, kind of like a lunge position, and then that's the best way to do it. And then from there, we can incorporate all sorts of interesting things like bending to the side and rotating the trunk and lifting the arm up and over and back. These are the types of things that we tend to do. Then we can really dig deep into that hip flexor complex, the iliopsoas complex, to get a deeper stretch into the areas that are very, very targeted and specific. But again, that requires being able to kneel on the ground and have the strength to get down, the strength to get up without overly straining, as well as the ability for the knee to be able to tolerate resting on the ground. Even on a soft surface, some knees just don't tolerate that. And so for that reason, some of these other methods of stretching the hip flexor complex are more realistic for people if they're over the age of 70, 80, 90 years old. Then we can incorporate the leg going off the edge of the bed. Again, safety issues with that, so we want to be very, very careful. But also we can go just lying on our stomach on our elbows, lying on our stomach and using a stretching strap. But if we are able to kneel and get on the ground, just do that. And even better, it also promotes that the person is getting on the ground and standing back up and kneeling and tolerating all these things and doing all these things more, because then that's a lot of strength to be able to get down to the ground and then be able to lift oneself back up. So that's very beneficial. So the fact that the person is doing that is very, very good.